Hello, this is Doug Clark, respiratory therapist with Ohio Health Cardiac and Pulmonary Rehabilitation. In this presentation, we will be talking about pulmonary medications, including oxygen. There are three main categories of pulmonary medications. The first is the maintenance medication. These are medications that are long-acting and must be taken every day as prescribed, whether or not you have symptoms. The goal with these are to prevent symptoms from occurring. These medications do not provide quick relief during a flare-up. Some examples are Spiriva, Advair, Breo, and Symbicort. The second category is the rescue medication. These are short-acting and give quick relief of symptoms. Your rescue medications are albuterol, levobuterol, or ipratropium albuterol combination. It is critical not to confuse your rescue medications with your maintenance meds. If you ever have a question about which category your medications are in, ask your physician, pharmacist, nurse, or a respiratory therapist. The third category is the inhaled corticosteroid. These medications reduce the inflammation, swelling, and mucus production in the airways. Maintenance corticosteroids include Advair, Symbicort, or generic budesonide, and fluticasone. After taking an inhaled corticosteroid, it is essential to rinse and spit with water. Failure to do so can result in a painful infection called thrush. This can result in non-compliance with taking the corticosteroid and having more frequent flare-ups. These pictures help demonstrate the action of these three medication categories. The dark brown bands shown are smooth muscle that constrict when irritated, reducing the size of the airway and resulting in difficulty breathing. The maintenance medications help to keep these muscles relaxed, but when that is not enough, the rescue inhalers are needed to give immediate relief. The corticosteroids help to reduce the inflammation and swelling in the airways that can also make it difficult to breathe. This is an example of a metered dose inhaler. It is extremely important to use a spacer chamber to get as much of the expensive medication into your lungs. Studies have shown that without the spacer, you get about 25% of the medication. With a spacer, you increase that percentage to 85%. This type of application is used for rescue and maintenance inhalers. This is a soft mist inhaler. It does not require the use of a spacer. This type of system is used for Combivent and Spiriva. This is a discus type of dry powder inhaler. This is exclusively a maintenance application. This is an ellipta type inhaler. This application is also exclusively a maintenance application. This is a Spiriva HandiHaler in which the capsule shown is punctured and a dry powder is inhaled. There is a confusing variety of inhaled medications available. Therefore, you should request instruction from your healthcare team in order to make sure you're using these appropriately. Here are some important administration tips. Using your inhalers in the right order will help them work better. If you are taking your rescue inhaler at the same time as your maintenance inhaler, always use your rescue inhaler first, before your maintenance inhaler. And remember, after using your corticosteroid inhaler, rinse your mouth with water and spit it out. These are some important tips for storage of your meds. Keep all of your inhalers at room temperature. Do not leave your inhalers in your car where they can be exposed to extreme temperatures. Keep your rescue inhaler where you can get it quickly. Do not inflate the medication canisters in water. This is some supplemental oxygen equipment. The oxygen concentrator separates oxygen from the atmosphere, therefore delivering mostly oxygen. Important things to remember if your physician prescribes oxygen is to use it as directed, whether it is prescribed continuously, with exertion, or at night. Only change your oxygen liter flow as directed by your physician. Increasing the amount of oxygen to more than what your body requires has been found to be detrimental to your lungs. This concludes the pulmonary medications presentation.